So I want you to know this. In your mouth, the pH is near neutral. The pH is near neutral, and this is maintained by saliva. And that there are two fluids that actually maintain your oral health. One is the saliva from the outside and your dental health, okay? One is the saliva from the outside, and the other one is blood from the inside. So those two fluids should be protected by all means. This tells you if your blood, quality of your blood is messed up, of course, your oral and dental hygiene is actually messed up. If your saliva quality is poor, and remember, saliva has a lot of things. Saliva has mucus that lubricates food. Saliva has microorganisms that protect you against harmful microorganisms. Saliva has also those microorganisms that actually make you the B vitamins. Saliva has water. Saliva has analgesics, painkillers. Imagine that. And the painkiller that is present in saliva is so potent. And at some point, the potency was compared to morphine. Imagine that. So your saliva is a super fluid and is there for a reason. But the quality of saliva nowadays is so messed up through the diets, of course. Through the diets, through our lifestyles. The quality of blood is even poor. Even poorer than you go donate blood and nobody wants your blood anyway. How about these tattoos all over? Nobody's wondering, you have diabetes and now you cannot donate blood. Imagine that. So you really long to donate blood to save lives, but you cannot because of the factors that you've actually done to yourself. You've drawn tattoos recently. You have you drink alcohol. You eat a lot of bad foods. You're diabetic, and all these factors around you. So you need to take care of that blood because from within, you see, for example, let's take just like sugar, the normal one that we talk about. Sugar messes your teeth from both without and within. From inside, when you have diabetes, whatever is happening to the root and the nerves of your teeth is a problem. Therefore, you start having sensitivity. I want to give you a scenario that you can relate to. There was a time when I was young and we used to call it somebody chewing a sweater or a cardigan. So when somebody is chewing that wool on a sweater, you feel so irritated. When somebody is pulling a chair, you feel so irritated because you're thinking your teeth are just going to fall off. Why? Because you've messed up your system from within. And when sugar is in blood, we say it's a very sticky substance, right? And then we say the complications of sugar is one, nerve damage. We say number two is, of course, the kidney damage. So therefore, again, it damages the amount and the quality of your blood because of the kidneys, because kidneys filter toxins from blood. So when you consume that sugar, you're actually affecting your blood concentration and your blood levels and even the quality of blood. And now, again, the nerves that supply the teeth are actually destroyed by sugar. So what do you expect? And now from without, your saliva is being affected, the quality of saliva is being affected. Again, you're causing yourself cavities. Cavities are basically those holes that start forming in the teeth. But I'll talk about cavities and I'll tell you what causes cavities. I'll also tell you what causes halitosis. Those people who just have a bad smelling mouth and they say, my blood is dirty. I eat garlic all the time to just make sure that my how many of you have ever eaten garlic to just cleanse blood? Hmm? Some of you chew garlic every time just because you have a foul smell and you think garlic will help you. Some of you smoke cigarettes and then you end up chewing the leaves of the cypress tree so that people don't know you just been smoking cigarette. Most of us are always chewing gum, thinking that this one is going to freshen up our mouths. But it's not doing any good to you because it's just sugar. You're actually loading more sugar in the system. Now, allow me to tell you this. As you chew that chewing gum, you're not going to be alert. Chewing gums don't make you alert. You just have sugar addiction, and the chewing gum is actually acting as something that gives you bits of sugar. Nowadays, people are complaining that the chewing gum is not as tasty as it used to be. When you just put it in the mouth, the sugar is gone. Now you're remaining with that gum. So your interest is not even the gum. Your interest is not even the chewing. Your interest is in the sugar. So when the sugar is done, you want another one. So people are smoking cigarettes, people are drinking alcohol, people are eating these simple and processed carbohydrates, people are chewing mirror, people are using these drugs, this stuff that you put under just behind your lips to give you a fake high. People are not fasting. People are eating sugarcane and people are eating sweets every single day. And now you're wondering, how am I getting all these issues with my oral health? How am I getting these cavities? Why am I always having a toothache? And you start feeding children from a very young age with these foods. You give them the yogurts, which are rich in sugar. You give them sweets. You give them cakes. You give these children honey. You give these children bread. And these children are always having dental problems. And I remember when we were young, of course, we used to eat sweets a lot. And we were aware. So we were being told, actually, if you continue eating these sweets, you'll end up having teeth problems. But you couldn't help it because you're already an addict to sugars. And look at it this way. The food industry is very clear. The food industry comes up with oral health programs or dental care programs or treatment of cavities or extraction programs in hospitals for free. So free extraction programs. This is how they carry out the public the PR stunts. So they clean their name in the public so that you will never suspect that they are dangerous. Whatever they are doing is they're just coming up with this. So you can imagine a company that makes biscuits and confectionery, a company that makes soda, sponsoring dental health programs, offering to put in money in dental organizations, dental associations, to just pump in money so that they can defend their program. Even the pharmaceutical companies. Do you know of that toothpaste that you say at clear sensitivity and numbs the gum so that you don't feel pain? It's coming from a pharmaceutical company that starts with the word G. Have you ever read where your toothpaste brand comes from? It is actually coming from a pharmaceutical company. And it's very famous with the dentists. Every time they're doing something, every time they're extracting a tooth from your mouth, they're telling you this is the best one for sensitivity. Now you know. Did you know that that one is coming from a pharmaceutical company? Also, did you know that your famous herbal toothpaste, I don't want to mention the name, but it starts with a C. Yes, Tapona, you got it right. Did you know that that toothpaste, the famous one, that is even having now activated charcoal, that has herbal, and that is the longest serving, I think. Yes. Did you know that it has a warning? Have you ever read the warning? Yes, Lynn, you've gotten it right. Have you ever read the warning? The warning is very clear that do not use it in children below 6 years. This is a question to all of you. When did you start using toothpaste to brush your teeth? When? When did you start using toothpaste to brush your teeth? Because maybe I am insane, maybe I don't know, but at least I'm keen on reading these warnings and these ingredients and all that. And before I forget, there's something called sodium lauryl sulfate. There's something called sodium lauryl sulfate that is present in most of those toothpastes. We also have fluoride, right? So that toothpaste that we said has a warning is that famous toothpaste now has herbal, and all of you are running. Oh, it's herbal. You're running to it because it's now herbal. Where did they get the herbs from? Sorry, where did they get the herbs from? The same company makes activated charcoal toothpaste. But I've always told you here that imagine their bosses come here. There was that boss who came in the other day who brought in the issue of GMO, the one who supports us with AIDS. The gentleman comes here and says climate change issues here, climate change issues there, when he just came in a private jet that actually produces fumes that are so harmful to the environment. But he's coming here and then telling you, do not cut your trees because of climate change and climate change. This same gentleman sits on boards of these toothpaste brands. And he's telling you not to cut your trees. But his companies are coming up with toothpaste that is written on activated charcoal. So pause and listen to this question. Where did they get the trees to make the charcoal that was used for these toothpaste brands? Where? And you walk into a supermarket, you see a whole shelf of activated charcoal toothpastes. And of course, because you've heard Dr. Lewis saying activated charcoal should be used for brushing teeth, you're there picking it quickly, putting it in a shopping basket. This one is, I use activated charcoal toothpastes. Where did they get it from? Where did that company in Thika, the one that makes juices, Do you think those pineapples that are along the roads in Thika, do you think they are enough to actually feed the appetite that is coming from Africa, the whole of Africa? Eh? Don't you think you're crazy thinking that one company in Kenya makes juices that serve the whole of Africa using pineapples that are only present in Thika, the whole of Africa? No, we must be crazy. So you think that company can still chop down trees to make activated charcoal that can supply the whole world? Start being very wise. Start opening your ear, the deeper ear. Start listening keenly because it is a mess out here. How many of you started using toothpaste when you're about 2 or 3 years old? Brushing your teeth because you're imitating everything. Your mother gives you a toothbrush and then puts the toothpaste on it. And as you're walking, following her behind, you're doing what she's doing, brushing your teeth also. She gives you a cup of water, and then you sometimes you break the glass because you cannot hold it tight because you cannot even multitask. We started using it at a very tender age. But the warning was clear. Therefore, our mothers or our fathers did not take time to read the ingredients. The warning was very clear. Do not use it in children who are below 6 years of age. Warning number 2. If you ingest more than it is supposed to be used for brushing, underline it is supposed to be used for brushing. Nobody told you how much should be used for brushing. If you ingest more than it's supposed to be used for brushing, contact a poisons center. Hello? If you ingest more than it's supposed to be used for brushing, contact a poison center. Some of you even ate the toothpaste, right? Some of you swallowed it. And of course, nothing happened because we are Africans and Africa is our business. So you can eat everything and you still survive because your immunity is crazy. They tell you that if you ingest more than the amount that is supposed to be used for brushing, contact a poison center. In Kenya, the poison center is Pharmacy and Poisons Board. How many of you have ever contacted that poison center? I guess none. Not even the pharmacists, not even the medical practitioners, not anybody, not even the hospitals that have experienced drug reactions on patients and the patients have come back to report. Nobody has ever done that. For those pharmacists who do that, who report to the Pharmacy and Poisons Board, thank you. May God bless you abundantly. For those pharmacists who dispense drugs, then sell drugs, may God bless you. Good. So now your mouth has a very thin layer of cells. You see, when you bite yourself, that layer heals so fast, right? Because your mouth has rapidly multiplying epithelial cells that cover up your mouth. And then the saliva has immunoglobulins that help you in the healing process. The saliva has painkillers that help you recover. But look at this. The mouth is an absorbing surface. Somebody who has ever suffered a hypertensive attack, they have given nifedipine under the tongue. It's called sublingual. So it means it's absorbed so fast into the bloodstream direct. It doesn't go to the liver. So its action is actually so fast. The bioavailability is 100% here, just like an IV injection. Could be less, about 98% though, but it's very high. So that tells you the mouth, the oral cavity is actually an absorbing surface. So this person who wrote that warning was intending to tell you, if you swallow it, please, and if you swallow more than it's supposed to be used for brushing, contact a poison center. But what they didn't tell you is that the mouth can still absorb. So therefore, whether you swallow it or you don't swallow it, you still absorbed it. So how much fluoride have you been absorbing ever since you were 3 years? How much fluoride? And you know, fluoride, mercury, lead, and all these are metals that when they accumulate in tissues, in the liver, in the brain, they cause you problems. And not to mention, fluoride is actually causing fluorosis. So therefore, when they told you that fluoride is going to protect your teeth, it actually makes it worse. Makes it worse. So brushing teeth is very important because that's the basic. We have only three. We have the brushing the teeth, we have also the flossing, and I'll tell you the flossing technique. And then we have, of course, regular checkups. So you need to go for regular checkups. But this happens after you've had a direct technique, a good technique of brushing your teeth. You must have a soft brush. And you see all these things being preached by dentists. Use a soft brush to brush your teeth and all that. And do in a circular motion, put your toothbrush at 45 degrees angle. All these things are confusing. Some of us just take toothpaste and we are like, we're done. Move. So who cares about the 45 degrees angle? Who cares about the 45 degrees angle? You're like, 45, this is what, no, no, this one. No, nobody cares. So if you see Kushites having that stick, they call it miswak. I think I have mine somewhere. They use it to brush their teeth, and you think these guys are so traditional. Of course, every one of us is traditional. Whatever you having as modern is just adapted. So they use that stick that is called miswak, and sometimes it's religious, and sometimes it's actually cultural. It is a very good thing for brushing teeth. And when you look at them, you're thinking these guys are so backwards. They are not. They know what they're doing. So the foundation for proper oral hygiene starts with brushing your teeth in a very, very appropriate technique. But this has to be followed with the flossing because there are places in your teeth crevices that the brush cannot get to. So therefore, flossing helps you. You can actually buy those flossing agents. They are there. You can buy them and do that flossing. And when you're doing flossing using maybe a flossing thread, or some of you use just a thread. Okay, you just pluck a thread from somewhere and using to floss your teeth. Listen, be very careful not to hurt your gums. Because since you're eating so much sugar, of course, your gums are compromised already. So you don't want to actually tear them up using that thread. So be very cautious. So you can buy those flossing agents that are actually calculated, the like the length is calculated so it will not hurt your gums. So that one you can use it. So at least floss your teeth about in the morning and evening after a meal. Because again, the only reason why we brush our teeth is because we want to get the particles of food from the crevices of those teeth. Now understand the basics. I told you the mouth pH is neutral, right? So you don't want to change that pH. But foods change that pH. Alcohol changes that pH. Okay? Even fasting changes that pH. So in your mouth, you want to maintain a near neutral pH so that bacteria in the mouth that survive under the neutral pH can still survive there. That we don't grow unhealthy bacteria like the strep mutants in your mouth that will cause you the cavities. So you cannot say sugar causes cavities directly. No. What sugar does is sugar is food for this bacteria in your mouth. So these bacteria feed on the sugar, or sometimes they cause fermentation processes on the carbohydrate particles that are in your teeth, and then those fermentation processes yield lactic acid or acids. Now you see where you start to change the pH of the mouth? When you start making those acids in the mouth, remember your enamel, this white part of the teeth, is one of the hardest things in the body. Is very, very actually there was a time it was being compared to steel. Its toughness is in comparison to the steel. So that enamel, it's very hard for you to break it. But we can leach calcium because it's made up of calcium, boron, a lot of things. It's actually the bone. It's an exposed bone. So when you leach calcium from this enamel, you start making it weak. And what leaches calcium from this enamel is actually acids. So when you're there trying to eat that lemon, when you're there drinking that soda, and soda has a pH of about 4.5, that lowers the pH of the mouth. That actually destroys your saliva quality, and that actually hurts your teeth directly because it leaches out the calcium from the enamel. And now you start having these sensitive teeth. And imagine you started giving your child soda from an early age. You gave them sugar from an early age. Thank God they had milk teeth. So when they got destroyed, they lost the milk teeth and now they had new teeth. How about you? How about you who already shed the milk teeth a long time ago? Will you have new teeth? And now, because you don't want to go through the long way, you'd rather get that cavity and then they go and do a root canal. A root canal is actually you carrying along a dead tooth all through. Because they kill the nerve, they kill the root, and now they fill it up. And now you're walking on with a very dead tooth that can actually attract microorganisms and cause you a lot of problem. And did you know that dental health issues are very serious? You can easily die from that toothache or from that tooth infection. It is very sensitive. If you have hypertension, you know very well you cannot go and extract that tooth because of several reasons. You might die through an extraction process. So protect those teeth. Teeth give you an aesthetic value. When you just smile, people are like, this one is a warm one. This one is welcoming. When you lose teeth, how can you even call somebody's name? How can you even call somebody's name? How? Lewis. Yeah? Jesus. Yes. So you're there saying Jesus. So you can imagine if you lose those teeth, there's a problem. So protect them because they'll give you that confidence. They'll give you that boldness in talking ahead of people, in front of people. The confidence will ooze from you is because you now have a very good smile. But now you have those brown teeth all over. Now you have one teeth is gone. Uh, so brushing is very important and flossing is very important. So at least do it. So the only reason why you're flossing or brushing teeth is you want to get those particles off your teeth, because if you leave them there, the bacteria will act on them and fermentation processes will yield acids that will leach calcium from the teeth, and that will give you a very, very weak teeth or tooth, sorry. When that happens, now that becomes a serious problem. Now you'll be always on a dentist, not for regular checkups, but for extraction after extraction. So that feeling of that tooth and that root canal, you rather extract that tooth totally. Instead of just going to get a root canal, they kill the teeth, and now you're carrying out a tooth that's actually dead. That tooth that is dead can actually cause you more infections and you end up dying. It's a serious case. So just get it out. And now protect the other teeth by eating healthy. Okay, and doing those regular checkups so that if there's any problem there, and you can realize some of the teeth are so close together, and in this crevice, they start rubbing against each other and they start causing that. A decay can actually start from this place. Okay, so you can easily walk to a dentist and tell them, yeah, of course, I don't want the fluoride, but I want you to help me do some scaling here and there. Just help me to, but do not whiten your teeth also. Do not whiten those teeth. Don't. Okay. So when was the last time you went to a dentist? When was the last time? Huh? Are you still saving? One of my tooth is dead through a root canal. Yes. And you see, even the feeling of that tooth or those teeth is a problem, because there was a time they used to use amalgam. Amalgam is actually mercury. And mercury is one of the most toxic metals or heavy metals that has ever existed. Mercury. Dentists who are here, did you stop using amalgam? What do you use nowadays? You can enlighten us on that. Because there was a research that was actually going around and it was actually stepped on about the mercury and the filling. Amalgam is a mercury agent, and mercury is toxic to your liver, to your brain, to your kidneys. Even those ladies who use these mercury products to lighten your skin, please don't. Fasting, eating healthy will give you the healthiest skin. Try it one day and see.